Hello friends, this is SriRam and you're watching my channel. So today we are going to discuss about a certain group of viruses called coronavirus. So presently the world is facing a pandemic related to particular strain of coronavirus called COVID-19 disease caused by SARS coronavirus 2 type 2. Okay, so some of the basic information regarding these viruses I would like to share with you all. So firstly, coronavirus is a group of viruses that cause diseases in mammals and birds. So specifically, many types of these viruses cause respiratory infections in mammals as well as birds, like bird flu is there, swine flu is there. These are some of the diseases which are caused by them. Recently we had Nipah virus, also one of the causative agent of respiratory infections, Nipah virus. Okay, there are several strains of viruses. So the most commonest one, which causes common cold in human beings, is rhinoviruses. So rhinoviruses commonly infect upper respiratory tract and generally cause mild disturbance. Say they do not cause a severe infection in human beings. They are just mild infections. There are other strains also. Okay, so there are also severe infectious viruses like the SARS virus, MERS, and COVID 19, which is recently discovered in 2019. They mainly infect upper respiratory tract, and some of the common symptoms of these diseases are cold, fever, sore throat, sometimes swollen glands. In severe cases, it can cause pneumonia. That may be a viral pneumonia, or sometimes it may be secondary bacterial pneumonia. Also, in some people, it's also seen to cause bronchitis, that is, inflammation of bronchi and bronchioles. Again, that may be also primary viral bronchitis or secondary bacterial infection, which can cause bronchitis. Then, if we talk about a class of virus called rhinoviruses, common cold viruses, their severity is very, very less and they are mild. Every seasonal variations can cause outbreak of common cold virus. So generally, common cold has a very basic symptoms as runny nose or stuffy nose or congestion in the nose, sore throat. There may be sometimes tender tender throat will be there, or pain in the throat areas. In some older people, or in very small babies, there may be body aches also. But the time period required for that is 4 to 7 days. Within those days, the virus automatically is washed away or removed out from your body. As of now, till today, there is no treatment for most of the viral diseases, including common cold also. The tablets, whatever are available in the market, what you take for common cold, they just suppress the symptoms of the common cold and not treat the root cause of the disease. This is a very important point which we must all remember. The whatever tablets you consider for treatment of common cold, they are not treatment purpose, they are just to hide the symptoms or suppress the symptoms of the disease, but they do not treat the disease. Same thing happens with the other diseases also, like SARS coronavirus and MERS coronavirus. They are very severe and they are lethal. They can cause death also. So the reason behind why do they cause death is they infect both upper and lower parts of the respiratory tracts, which makes breathing difficult, and recovery becomes more and more difficult with respect to age, immunity, and so many other factors. So what is SARS? SARS is also a type of coronavirus. The full form of SARS is severe acute respiratory syndrome, and the virus which causes it is called as SARS coronavirus 1 or SARS coronavirus. So the outbreak of SARS was being reported in 2003. Then there is another one strain of this virus called MERS. The full form of this MERS is Middle East Respiratory Syndrome. Again, this is also caused by a strain of virus called MERS coronavirus. The outbreak of MERS coronavirus took place in around 2012. Then the most awaited information of COVID-19, the disease which is presently declared as a pandemic by WHO, which has been spread most of the countries in this world. And the origin of it is basically said to be in Wuhan of China, but still the research is going on about that, and we'll talk about it later. So, COVID 19 is a strain of SARS virus itself. So, the name of the virus is SARS coronavirus 2 or SARS CoV 2, which was discovered in 2019. So, the disease is called as COVID 19 infection or COVID 19 disease. So, symptoms of COVID 19, if you talk about, there are two categories of symptoms. Most common symptoms in most of the people, there are some rare symptoms in some individuals. So, first of all, if you talk about the common symptoms of coronavirus, that is COVID 19 disease, it is fever, tiredness, dry cough, and difficulty in breathing. If any three of these you have and you are there is something called as human psychology also. When the whole world is talking about the symptoms, and if you come across these symptoms many times because of psychological factors, you may have common cold and you may feel you may have COVID-19, but still it's always advised to take a medical what you call as advice for such type of difficulties if you are having. So fever, tiredness, dry cough, and difficulty in breathing, any three of these combinedly you are having as a symptom, then you must immediately talk to your primary health care or doctors. Rare symptoms are also seen in them, like body aches, body pains, nasal congestion in some people, runny nose in some people, sore throat, and also sometimes diarrhea. Okay, so these are the symptoms which are commonly been discussed by WHO regarding the COVID-19 pandemic disease. What is the particular incubation? As such, the research is still going on. We exactly do not know the incubation, but approximately the people who have been infected, in such people we have come across the incubation to be around 5 to 6 days as a primary stage of incubation. In some people who have a higher tolerance or higher immunity, the symptoms may not be shown by them until 14 days also. Okay, so it's unpredictable depending upon the phase of what you call as your body routine and the activity of your immune system. The incubation period differs from individual to individual. So basically, prevention is the best thing for viral infections, because as such a perfect treatment for them is not present in this world. We can only prevent them, and we can, if there is an infection, we can only treat the symptoms, not the root cause of disease. The virus has to go by itself naturally from your body, and it cannot be killed by the medicines you take during the admission in the hospital. So what are the preventive measures? So all over the world these preventive measures have been taken. Stay at home, the first one, that is lockdown of the country and lockdown of different parts of the country, and keeping social distance. Keeping social distance means as far you can keep the distance between two individuals when you are talking or when you are buying something, when you are in a market. Keep a very safe social distance. And whenever any person, it may be you or anybody else, while coughing or sneezing, you must cover your mouth. It's better to wear a mask which can filter the viruses, or at least you can cover it with the cloth. Okay, so coming to how the mode of transmission is seen in COVID-19, mainly the present understood theory of transmission is mainly by the aerosols or droplets of an infected person which come out of the body when the person sneezes or coughs without covering their mouth. Then also by infected surfaces touched by the affected person. If an affected person touches different surfaces without cleaning his hands, then the viruses may be transferred on the surfaces also. And you can have a good data on your internet about on what surfaces, what is the time period for which the vulnerability is seen about the coronavirus, or what you call as COVID-19 virus, SARS coronavirus 2. Okay, so this is an information which is very important to be discussed with the people, because there are many rumors, many confusions been created about the coronavirus. Somebody is telling, coronavirus has been explained in your second PUC, what you call as textbook. You can take the treatment from there. See, it's not like that. Coronavirus is not a single virus, it's a group of viruses which includes different types in it. And the severe ones are what the three I have discussed here, that is SARS, MERS, and coronavirus presently, that is COVID-19. So, outbreak of these diseases is very, very severe and very, very life threatening in many countries presently. Lakhs of people, thousands of people are infected, thousands of people are dying and they are dead. So it's better to prevent these diseases by keeping our hygiene perfectly. Keep your house clean, keep yourself clean, keep your body clean, keep your surroundings clean, and stay safe and stay at home. Thank you.